All right, welcome back. Hope you're all having a fantastic week. Today, we are continuing our RBT exam review with our latest practice exam. We'll go through the next set of questions together and break them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and most importantly, subscribe. If you're looking for our proven study materials, please check out rbtexamreview.com. We offer 3 practice exams, a study guide, and of course, our famous combo pack. As always, questions, comments, let us know. Work hard, study hard. Let's get to our questions. Question 1. When choosing responses to use in a high probability request sequence, what should you take into consideration? Questions like these are asking you to dig a little deeper and think a little harder. We have a term, so what are we going to do? We're going to define it. A high P request sequence is when we ask a series of high probability requests to build behavior momentum, and then we follow it with a low probability request. Clap your hands, stomp your feet. What's 2 plus 2? You should know what a high P request sequence is. Now, questions like these are going to make you think a little harder about actually using a high P request sequence, because this question is asking what responses, when choosing responses, what do you need to take into consideration with a high P request sequence? So, A, is the response in the learner's repertoire? Would it be important that the learner knows how to do the request you're asking them to do? Well, of course. If it's a high probability request, they need to be able to engage in that request very easily and very frequently, meaning they have to know how to do it. The repertoire is just all their set of skills and what they are able to do. So if we want to include a request in the high P request sequence, it needs to be in the repertoire. B, does the learner reliably engage in the response? Now, if you want to choose a request, it has to be high probability, right? We can't choose a request that they only sometimes engage in because you ruin the whole intervention. The intervention is all about building momentum by completing requests. So you notice how A looked like the right answer, but we didn't stop there. Because what do? We read every single answer choice. When people pass their exam, some of the main feedback we get is, thank you for letting me know that I need to read all my answer choices. It forces you to slow down. It forces you to read and engage with the question. So A looks right, B looks right. What about C? Can the client verbally communicate? Does it matter? Well, think about a high P request sequence that would involve you asking your client to clap, to stand up, and then to wash their hands. Does that involve any client verbal communication? No. So C isn't really relevant. However, when choosing responses to use in a high P request sequence, the responses must be in the learner's repertoire, and the learner needs to reliably engage in the response. So our answer here is going to be D, A, and B. That's kind of a hard question we're starting off with today. If you got it right, fantastic. If not, just go back and review. That's why we're practicing. Question 2. My 10-year-old nephew loves flipping through channels on the television. He'll do this for hours if you let him. His dad finally took the remote, removed the batteries, and gave the remote back to my nephew. Now, my nephew no longer plays with the remote. What type of intervention did the dad use? Okay, think carefully here. Intervention question. So, what intervention did the dad use? Remember, when we have more than one individual involved in our questions, always be sure you know who we're looking at. This one specifies the dad. So, what did the dad do? Well, he took the remote, removed the batteries, and gave the remote back to the nephew. So, before he took the batteries, the nephew could flip through the channels all he wanted. After that, the nephew can't. So what would happen? If he were to push the buttons, nothing would happen. He can't flip the channels. So what did the dad use? A, positive punishment. Positive means what? It means we added something. Did the dad add anything to the scenario? He did not, right? He didn't add any stimuli. He didn't add anything new. So it cannot be a positive intervention. B, negative punishment. So be careful here, right? Remember, punishment and extinction, 2 different things, both decrease behavior. Is this negative punishment? Did the dad taking away the remote lead to the decrease in behavior? Well, no, because as soon as he took the remote away, he gave it back. But what he did was he removed the batteries first. So what happened when the client tried to push the buttons on the remote? Well, no reinforcement was given. And when we withhold reinforcement for a previously reinforced behavior, what do we call that? We call it extinction. The client's behavior, or the nephew's behavior, was put on extinction because Now, every time the client tries to hit a button, what happens? Nothing. The behavior is put on extinction. And then D, negative reinforcement. Of course, it's not reinforcement. Why? Well, the behavior decreased. So it can't be reinforcement. If you start to think about our terms in simple ways like this, right? We know the behavior decreased, reinforcement is out. Then you can start to easily eliminate some answer choices. This one's a little tricky because negative punishment is very tempting. But remember, we're withholding reinforcement, right? Because the nephew has the chance with the remote to change the channel, but it doesn't work. We're putting his behavior on extinction. Yesterday, I bought some pumpkin spice English muffins from the store. While upstairs today, I could smell breakfast being prepared. My wife sent me a text that said breakfast is ready. I walked downstairs and ate breakfast. What is the SD for walking downstairs? Now, the question is asking about what? It's asking about walking downstairs, specifically the SD for walking downstairs. So the SD is signaling reinforcements available and it's evoking behavior. So what evokes walking downstairs? Well, let's break it down, right? Yesterday I bought pumpkin spice English muffins from the store. Does not evoke me walking down the stairs, right? Maybe a setting event, but it happened yesterday, not today. While upstairs today, I smelled breakfast being prepared. Did I start walking when I smelled the breakfast? I did not. Smelling the breakfast might be a motivating operation, however, okay, might increase the value of walking down the stairs because that's where breakfast is, but it isn't the SD. It didn't evoke the behavior. But when my wife sent me a text that said breakfast is ready, then I walked downstairs and the consequence was getting breakfast. So the SD for walking downstairs is what? The text message. The SD is the text. The response is walking downstairs. The consequence is getting breakfast. Now you have to break down these questions, especially during practice. The more you do it, the better you get, the quicker they become. Don't be frustrated if you're new to this or you're still learning and this is challenging in the beginning. It's supposed to be. Take your time, go slow. Which of the following answer choices is a possible unwanted effect of punishment? All right. We're looking for an unwanted effect of punishment. Hardest part about this question is reading the question carefully. Okay. So we're looking at punishment. We're looking for something unwanted about punishment. Well, what do you know about punishment? Punishment, our goal is to decrease behavior, right? We're adding an aversive or taking away something in response to a behavior, the goal of reducing behavior. So A, the target behavior decreases. Is that unwanted? No, that's our goal, right? B, the client stops engaging in maladaptive behavior. Is that unwanted? Nope. With punishment, that's what we want to see. C, the target behavior increases. If the target behavior increased, would we consider that punishment? Absolutely not. So you have to be careful there, okay? It wouldn't be an unwanted effect of punishment because the target behavior increasing is not punishment. It would be a form of reinforcement. So that leaves us with D. The person delivering the punishment becomes aversive. Think about abuse. Person delivering the abuse eventually becomes very aversive to the person receiving the abuse, to receiving the punishment. So that is absolutely a potentially unwanted effect of punishment. Whoever delivering the punishment becomes aversive. So we have to be very careful with punishment. It can lead to aggression. It can lead to aversions. Ethically, punishment is very difficult to do without a lot of support and resources. Okay. Now, that's neither here nor there, but let's just answer the question. Which is the following answer choice is a possible unwanted effect of punishment? Going to be D. Person delivering the punishment becomes aversive. Which major component of a functional behavior assessment is the least effective at identifying the function of behavior? FBAs, functional behavior assessments. Think about our triangle. Okay. At the bottom, we have, depending how you look at it, indirect assessments, right? Indirect assessments, surveys, checklist. Then we go to direct assessments, ABC recordings, event recordings, narrative recordings, actually watching the learner. And then finally, we have functional analyses where we are actually trying to manipulate things in the environment to determine the function of the behavior. And functional analyses is always going to be the best way to identify a function. With that said, what is the least effective? Well, it's going to be an indirect assessment. And why is that? Because we're not actually observing anything, right? We're not seeing anything occur. We're not watching the learner. We're just asking indirect questions. How can we truly identify a function if we're not actually observing the behavior happen? We can't. So the least effective way of identifying functions of behavior is an indirect assessment. An RBT is trained on a reinforcement procedure to increase the number of times their client washes their hands in the clinic. However, parents report to the RBT that the client no longer wants to wash their hands at home. This is an example of what? Very important behavioral concept. Happens all the time, especially if you work in clinics or you work in schools. So, what do? Well, we change something in one setting, for example, the clinic, and the behavior increases at the clinic. Then we go to school and the behavior decreases. Or vice versa, right? The behavior decreases at the clinic because we change the schedule, and in school it increases. What is occurring? Is it the pre-map principle? Well, the pre-map principle, we've had a lot of questions lately on. Pre-map principle is the opportunity to engage in a preferred activity after you engage in a non-preferred activity. Not what we're looking at here, right? We're looking at two different settings and behavior changing in each setting. B, behavior contrast. Yes, behavior contrast is what we're describing. Behavior contrast is the phenomenon where if you change something in one setting and the behavior changes, there's a tendency for that behavior to change the opposite way in another setting if nothing has changed in the other setting, which is exactly what is happening here. There's behavior contrast occurring. Not an extinction burst. Okay, we're not even talking about extinction here. We're talking about reinforcement. And it can't be spontaneous recovery either because we're not talking about extinction. So this has to be an example of behavior contrast. Client increases hand washing in clinic, reinforcement change. Now at home, they're not getting the same amount of reinforcement. Behavior is going down or staying the same. If you wanted to establish praise as a reinforcer, which of the following procedures would you want to try first? So you want to establish praise as a reinforcer. How do we establish praise as a reinforcer? Well, we do it through pairing. And through pairing, we can take a conditioned reinforcer or a unconditioned reinforcer and create new reinforcers. So we're looking for a procedure that involves pairing. So A, praise the client continuously as they engage in desired behaviors. Well, if praise is not a reinforcer, is it going to change by just doing it over and over again? No. Okay, there's nothing you're pairing praise with just magically to create a reinforcer by saying it over and over again. B, whenever you deliver a reinforcing token to the client, also provide them praise. Okay, now what are we doing? Well, I've got my reinforcing token, and at the same time, I'm providing praise. I'm trying to pair the two together to create a situation where the praise takes on the reinforcing properties of the token. B looks pretty good. C, praise the client before you run each trial. Again, we're not doing it before, and praise doesn't function as a reinforcer yet, right? We have to pair praise with something that already has reinforcing properties so that it obtains those reinforcing properties. And then D, deliver candy corn and praise at the same time to the client when they engage in desired behavior. Do we know if candy corn has reinforcing properties? We have no idea. The client could hate candy corn. We don't know anything about candy corn. So praising candy corn could actually produce the opposite effect or no effect. We don't know anything about candy corn. In order to establish praise as a reinforcer, we have to pair it with something that already has reinforcing properties, which would be B. Whenever you deliver a reinforcing token to the client, also provide them praise. You notice on a day that your client's dad is watching session closely. He starts asking questions about some of the procedures you are using. You think he would benefit from parent training. You ask your BCBA if you can teach him a couple of things and your BCBA approves. What should you do next? Okay. Typically, RBTs don't do parent training without support and guidance of a BCBA. In this case, however, what happened? Well, you asked permission from your BCBA to teach a couple of things and your BCBA approved. So how can you proceed? What should you do next? A, nothing. RBT should never conduct parent training. Not true. You got permission from your BCBA to conduct parent training. You have the right to conduct parent training. B, only conduct parent training while your BCBA is there. Again, not necessarily true. As long as your BCBA believes that you are capable of conducting parent training and gives you permission, you are able to conduct the parent training. C, conduct parent training on anything you want and record it in your session notes. Absolutely record it in your session notes, but be careful about on anything you want. Just because you got permission doesn't mean you can just go do whatever you want. Instead, go with D. Conduct parent training on approved skills and record it in your session notes. D reflects the task list and the ethical code of communicating with your BCBA, only engaging in approved acts, and documenting your services. So D fits the bill. Okay, you are approved for parent training. Make sure you get approval for what you want to train on, and then record it in your session notes. Finally, Tom Brady threw for 40 yards in the first quarter, 100 yards in the second quarter, 70 yards in the third quarter, and 80 yards in the fourth quarter. How many yards did Tom Brady throw for on average? Well, we put this in here because it's important that we know how to do averages for the BCBA exam. How do you find an average? Well, you add up all your data points. So we're going to add up 40 plus 100 plus 70 plus 80, and then you divide it by the total number of data points, which is 4, and you get 72.5 yards. Averages, totals, very easy. Understand how to find them. If you do not know how to find them, you need to teach yourself and you need to practice it. It's an extremely important skill to have. All right. Thank you for watching. Please check out rbtexamreview.com. Like and subscribe. Questions, comments, let us know. Work hard, study hard. See you soon.